Welcome to Pakistan, a nation rich in culture and diversity. But beneath the vibrant tapestry of daily life, there lies a silent epidemic affecting millions: diabetes. Diabetes is a growing health concern worldwide, and Pakistan is no exception. With over 30% of the adult population diagnosed with this chronic condition, its impact is far reaching and profound. One of the most significant yet often overlooked complications of diabetes is its effect on vision. Diabetic eye diseases, including diabetic retinopathy, cataracts, and glaucoma, can lead to severe vision loss if not properly managed. In this documentary, we will explore the impact of diabetes on eye health, hear from experts about prevention and treatment, and share the stories of those living with these challenges. Join us as we shed light on this critical issue and work together to protect our vision and our future. This is The Silent Threat: Diabetes and Eye Health in Pakistan. To better understand the complexities of diabetes and its impact on our health, we turn to Dr. Maria Ahmed, a leading endocrinologist with over 15 years of experience in managing diabetes and its complications. Today, Dr. Maria will share insights on the preventive measures we can take to manage diabetes effectively, as well as the crucial diagnostic tests needed for early detection. Her guidance is invaluable in our collective effort to combat this widespread condition.
Assalamu alaikum. My name is Dr. Maria Ahmed. I am a physician and my subspecialty is diabetes. I am currently working as a diabetologist at Farooq Hospital, Lahore. I am here to give you an overview of what is diabetes, what are its types, how we can diagnose and how we can prevent it. Diabetes is basically when your blood sugars remain constantly high due to the non-production of normal insulin hormone, which has the ability to digest the sugars. There are basically two types of diabetes: type 1 diabetes and type 2 diabetes. In type 1 diabetes, it is an autoimmune condition and our body is attacking the normal islet cells in the pancreas which are producing the insulin. So there is no insulin inside the body. And the type 2 diabetes is when there is a little bit of insulin inside your body, but your body is not able to respond to the increasing sugar level within it. Type 2 diabetes is more common as compared to the type 1 diabetes. Regular screening and a diagnostic test are the key to detection of diagnosis for the people who are prone to develop it. The tests we are conducting these days are fasting blood glucose, random blood glucose, oral glucose tolerance test, and hemoglobin 1AC. Prevention of the diabetes, it starts with the lifestyle changes. We need to take a balanced diet. It is very important. We should be taking balanced form of fruits, vegetables, proteins, and less carbs. We also need to cut down the processed food. Same is the case with the physical activity. Physical activity is very crucial component. We must be doing 30-minute exercise a day in the form of cycling, brisk walk, or running. Remember, diabetic management and prevention requires a provocative approach. Regular checkups, a healthy lifestyle, and early detection through diagnostic tests can make a huge difference. Stay informed, stay active, and take good control of your health.
Okay, so now that we know what diabetes is, we can focus on this documentary's main topic of discussion: its effect on ocular health. For this, we contacted Dr. Ali Bodla, who would discuss the consequences that diabetes leads to the eyes.
Assalamu alaikum ji. My name is Dr. Ali Afzal. I'm a consultant ophthalmologist, a retinal surgeon, and a professor in ophthalmology here in Multan, Pakistan. In Pakistan, we have got estimated population of 260 million. And in this whooping population of 260 million, it is estimated that there are approximately 40 million people who are definitely suffering from diabetes or who are known diabetic. Now, when it comes to such a large population of diabetes, obviously we are not looking at just the diabetes. but the complications that are arising from diabetes. And there are three main organs getting involved. Number one are the kidneys, number two, eyes, and number three, nerves, like the diabetic neuropathy. So today I'm just going to talk about diabetes with its relationship to the eyes, because as an eye specialist, what I'm dealing day in and day out are the patients coming to me or to other ophthalmologists with complications in their eyes due to diabetes. Now, diabetes, it can affect any part of the body, but when it comes to the eyes, the part that mainly get affected is the back of the eye. Now, this is something which we call as retina. Hence, the term diabetic retinopathy is used when we try to explain the effect of diabetes on the eyes. When we talk about diabetic retinopathy, we have to stage it as we stage any other disease. So we stage into stage 1, 2, 3, and 4th, the final and most advanced stage. Now, surprisingly, when the patient comes to us with the eye problem due to diabetes, majority of those patients are already on the 4th or last stage of diabetes. Why? Because unfortunately in our country, there is no diabetic retinopathy screening services. So majority of the people would come with a problem once they have got that problem, or they have got to the last or end stage of that problem. And then it becomes very challenging and very difficult to deal with these problems. Now, the 4th stage of diabetic retinopathy is called as proliferative diabetic retinopathy. Now, what does proliferation means? It means by that time, those patients would already have had developed abnormal blood vessels at the back of the eye, on the retina. And when you develop abnormal blood vessels, the second stage is that you are going to bleed. So a lot of those patients are coming with massive bleeding and hemorrhages within the eyeball. And that is one of the most challenging thing to control or to manage. So once we get a patient in our clinic, the first thing is we just check their visual acuity, that how good they can see. We check the number of their glasses. We do what is called as a slit lamp examination. Now, slit lamp examination, as you can see a slit lamp lying next to me, is we are going to look at the front part of the eye and we are going to look at the back of the eye. Now, this is something that an examiner, a doctor, manually does. When we look at the front of the eye, the back of the eye, we look at the changes inside the eye due to diabetes. Now, those changes can involve any part of the eyeball. The people can develop early cataracts because of diabetes. They can develop glaucoma, a kind of glaucoma due to diabetes, or they will have diabetic retinopathy due to diabetes, or they will have a collection of all of these problems. Once we have identified the stage of diabetic retinopathy, once we know where they stand, once we know the clinical findings, then we decide whether we need to do any investigative procedures or not. Now, in investigative procedures, there are angiography. The way you do angiography of the heart, the way we do the angiography of the eyes. Why? Because the blood vessels get mostly affected due to diabetes. So we do an angiography to see whether there is any leaking in the blood vessels. We do something which is called as an OCT. Now, the term OCT means optical coherence tomography. It is a kind of CT, or you can say a MRI scan of the retina, the back of the eye. It is done through light. It is not done through radiations. And we have got facilities of OCTs here as well. Now, what does a OCT tells us? An OCT gives you the most precise and detailed image of the retina, looking at each and every cell layer and identifying where the problem is exactly and how should we be managing it. Once we have done the clinical assessment, once we have done the diagnostics, then comes the management. Now, the management of diabetic retinopathy, it is primarily divided into 4 stages. The first stage is that we do not have to do anything. We just have to identify the stage, and we just inform the patients that they should be very careful about their diabetes control, and they should come back and see us in 6 months, 3 months, or a year's time. That is the first part of the patients. Now, the second mode of treatment is in the form of the laser. Many times to the swollen retina, we do some laser, which burns, which puts some spots on the retina, burns a part of the tissue. That is one mode of treatment. The other mode of treatment is in the form of injections. Now, the injections are called as anti-VEGF injections. VEGF stands for vascular endothelial growth factors. So in these patients, there are a lot of abnormal blood vessels being coming up. So what we have to do is we have to control the proliferation of those blood vessels by giving the injections. And the third mode of treatment is that we go inside the eye, we clean all the blood, we straighten up the retina, and this particular procedure is called as vitrectomy. So here we do vitrectomy as well. So all different modes of treatments. So coming to the results, the problem with the retinopathy or the retina is that you can't change it. You can't change a bad retina with a good retina. For this reason, some of the patients, they tend to do really well. Some patients, the results are not very good depending on the stage of their disease. And in some patients, you just try to control their level of vision. You just try to stabilize them. So we have to look at each and every patient individually, and each and every patient respond in a very different way depending on the severity of the disease that they have got.
Diabetes affects millions of lives around the world, each story unique yet interconnected by common challenges and triumphs. Today, we delve into one such story, that of Mrs. Alia Tawassum. Mrs. Alia is a 37-year-old mother who has been living with diabetes over the past 7 years. Alia's journey with diabetic eye problems is one of resilience and adaptation.
अस्सलाम वालेकुम। मेरा नाम आलिया तबस्सुम है और मेरी एज 37 है। मुझे आज से 7 साल पहले शुगर की प्रॉब्लम हुई। पहले तो मैं एक्सरसाइज वगैरह करती थी, उससे ही बेहतर रहा, लेकिन अब 2-3 साल से मुझे मेडिसिन पे भी जाना पड़ा। इसकी वजह से मेरी आंखों में भी मुझे शुगर की वजह से प्रॉब्लम फ़ील हो रही थी, काफ़ी धुंधला महसूस कर रही थी। जब मैंने टेस्ट करवाए तो मुझे पता चला कि मेरी नज़र काफ़ी वीक हो चुकी है। असल में ऐसा है कि मुझे रात में देखने में प्रॉब्लम होती थी, धुंधला फ़ील होता था। जब मैंने डॉक्टर को टेस्ट करवाया तो उन्होंने कहा कि आपको रेटिनोपैथी हो चुका है, जिसके बायस मुझे काफ़ी तंगी होती थी, रात को दुश्वारी महसूस होती थी देखने में। डॉक्टर साहब ने जब मुझे बताया कि डायबिटीज़ की वजह से आंखों में इतनी प्रॉब्लम हो रही है, तो इस वजह से मैं बहुत ज़्यादा खौफज़दा हो गई थी। फिर मुझे डॉक्टर ने बताया कि आपकी जो आंखों में खून की नालियाँ हैं वो लीकेज हो चुकी है उसमें। इसके बाद मुझे डॉक्टर साहब ने बताया कि आपका ऑपरेट होगा, और ये काफ़ी मुश्किल प्रोसेस था, लेकिन ये है कि ऑपरेट के बाद काफ़ी बेटर फील किया मैंने। इसके बाद अब मैं एनिक यूज़ करती हूँ ताकि और नाइट टाइम में या पढ़ने के वक्त किसी भी वक्त मुझे कोई प्रॉब्लम्स ना हो। इसके अलावा ये है कि मैं अपनी डाइट वगैरह का बहुत ख्याल करती हूँ और अपनी एक्सरसाइज रूटीन में करती हूँ। असल में ऐसा है कि मेरी फैमिली ने मुझे बहुत सपोर्ट किया। डॉक्टर्स की अपॉइंटमेंट जो भी सब में मेरा उन्होंने बहुत साथ दिया है। इसके अलावा मेरी डाइट का बहुत ख्याल रखा गया। ये सब चीज़ें मेरी फैमिली ने मेरे साथ मुझे बहुत ज़्यादा सपोर्ट किया, जिसकी वजह से ये सब मुमकिन हुआ। लेकिन मेरी आप सबको यही एडवाइस है कि जिसको भी डायबिटीज़ हो उसको चाहिए कि वो अपनी डाइट का ख़ास ख्याल करें, अपनी एक्सरसाइज रूटीन में रखें, और अपने डॉक्टर के साथ अपनी अपॉइंटमेंट कभी उसको मिस ना होने दें। अपने डॉक्टर के साथ हमेशा उसके तामुन से चलें।
But it's not all bleak. With early detection, regular eye checkups, and proper management of diabetes, we can prevent most of these complications. The key is awareness and access to care. Communities across Pakistan are taking steps to combat this issue. Local health programs and NGOs are working tirelessly to provide education and medical services, reaching even the most remote areas. Prevention and management start with lifestyle changes. Simple steps like maintaining a balanced diet, Regular exercise and routine medical checkups can help manage diabetes and protect your vision. Remember, your health is in your hands. Make informed choices, seek regular medical advice, and don't ignore the signs. Together, we can fight the silent threat of diabetes. Let's commit to a future where diabetes does not steal our sight. Share this knowledge, support those affected, and advocate for better healthcare access. Together, we can make a difference. Thank you for watching and taking a step towards a healthier future.